Hi and welcome. Let's briefly differentiate between placenta previa and placenta abruptio, also known as placenta abruption. Now we have a diagram of a normal placenta here implanted in the upper uterine cavity and an abnormal placenta implanted in the lower uterine cavity, covering the cervix partially or completely. And here we have a diagram of placenta abruptio. You can see where it is external, resulting into external bleeding or resulting into internal bleeding. So in placenta abruptio, the placenta is usually separated from the uterus. So now let's look at the bleeding patterns in placenta previa and placenta abruptio. So in placenta previa, the bleeding pattern is painless. The blood is bright red. It is recurrent. It is unpredictable. It often starts after 28 weeks. While in placenta abruption, the bleeding is painful. The blood is dark in color. It is sudden in onset and often continuous. Next is the pattern of abdominal pain / uterus. In placenta previa, there is no abdominal pain. The uterus is soft, non-tender. Fetal parts easily palpable. So in placenta previa, you can easily palpate or feel the fetal parts. While in placenta abruptio, there is severe abdominal pain. Uterus is tense, rigid, and tender. It is bird-like. Fetal parts are difficult to palpate in placenta abruptio. So let's move to the differences in the uterine cavity. In placenta previa, there's normal uterine tone, no contractions unless labor begins, while in placenta abruptio, the uterus is hypertonic. There is frequent painful contractions. So what's the fetal status in placenta previa versus placenta abruptio? In placenta previa, there's usually normal fetal heart rate initially, and there's also an increase in risks if bleeding is heavy. While in placenta abruption, fetal distress is common. There is high risk of fetal death. Always remember that there is high risk of fetal death in placenta abruptio than in placenta previa. So next is maternal status. In placenta previa, the hemodynamic instability depends on blood loss. Shock only after very heavy bleeding. So in placenta previa, the hemodynamic instability is as a result of the blood loss due to bleeding. Why there is shock after very heavy bleeding. So if there is no heavy bleeding, you don't expect shock in placenta previa. While in placenta abruption, shock may appear disproportionate to visible blood loss. So in placenta abruption, the blood loss may be little, but there will be shock. Hence, some of the blood is retained in the placenta or within the uterus. So you wouldn't see much bleeding, but there will be shock. So there's risk of disseminated intravascular coagulability. Very important exam point, so you should never forget that in placenta abruption there is high risk of disseminated intravascular coagulability. So next is vaginal examination. So in placenta previa, digital vaginal exam is contraindicated. It can trigger massive hemorrhage. Diagnosis is confirmed by ultrasound. So in a nutshell, in placenta previa, you don't do digital vaginal exam because it is not allowed. And you should also know that placenta previa can trigger massive bleeding, and diagnosis is confirmed by an ultrasound. So in placenta abruption, vaginal exam is safe. Diagnosis is primarily clinical. Ultrasound may be normal. So in placenta abruptio, you can do vaginal examination and diagnosis is basically from your history and physical examination, but you can as well do an ultrasound if you want. It's normal. So next is ultrasound finding. What are the findings in placenta previa? The placenta is usually covering the internal cervical opening, easily seen on an ultrasound. While in placenta abruption, there is retroplacental clot which may be seen, but ultrasound misses up to 40% of all placenta abruption. So mostly you depend on the history and clinical examination here to find out. So the fastest way to remember the differences between placenta previa and placenta abruption is that each time you think of a placenta previa, you should remember that it is painless, the blood is bright red, and there is a normal uterus. While in placenta abruption, it is painful, the blood is dark in color, and there is a rigid uterus. Thanks for listening. Do not forget to like, comment, share, and subscribe if you found this video useful.